Centering Pregnancy is a program where we are providing not only their education, but their prenatal care as well in a group setting. So the moms are all from the same month due date. So the questions that they would normally have in their prenatals, most of the other moms in the group will have. So we do a very short prenatal where the midwives are going to listen for the baby's heartbeat, and they're going to measure mom's belly and do those medical things that need to be done. But the patients are encouraged to really be involved in their own care. So we teach them how to do their own blood pressure. That's what they do when they first come in for centering. They also get their own weight. They keep track of all of these things so that they can kind of see how their pregnancy is progressing and kind of understand exactly what's happening in their pregnancy. It builds community. They support each other well after their babies come, and that's actually when I see a lot of my groups bond, is in that postpartum time. Just being able to talk to someone else when you're going through stuff with a newborn that is going through it also is really helpful. There are 10 centering sessions. The first 4 are every 4 weeks that would go along with the prenatal appointments. Then we go to every 2 weeks after session 4. And even when they get to about 36 weeks, they'll be seen individually, even in between centering sessions. We talk about pregnancy, common pregnancy discomforts, how to encourage them to share what has helped them. So we ask a lot of open-ended questions. It's supposed to be a lot less of us talking and at them, and more them answering questions as to what helped them. And then we kind of intervene and join in when they need a little bit extra help on an answer for something. We talk to them about all their prenatal testing, exactly what's happening and why we do certain things so that they understand that. And then we go into labor and delivery. We really focus a lot on the emotional preparation for labor and delivery and for parenting. That, a lot of classes will focus on just the physical. Like here's the positions that you can use, and here's all these different techniques to try during labor. But there's a lot of mental things that go into that, and things that can cause your labor to stop because you are not mentally prepared for it. And so it's not just the physical stuff, but it's the mental stuff that's really, really important. And then we really talk about what happens here at the birthing center after their babies come, the newborn exam, and how to take care of a newborn. It can be really frightening and nerve-wracking, and we try to prepare them just to be able to have confidence in what they've learned and feel like they can do this. Then we talk about postpartum depression, which is really important, postpartum anxiety. We talk about contraception and sex after baby because a lot of people don't talk about that. We have a whole session that's on breastfeeding, and that's just 2 solid hours of talking about breastfeeding because it's natural but also learned. So babies are made to do that, but they also have to learn because they're an individual and mom's an individual, and we gotta learn it together. And then the most fun thing is that when we have all of our babies, about 6 weeks after our last mom has her baby, we get back together and we have a reunion with all the babies, and that's really, really fun to tell their birth stories, kind of talk about how that went for them, and to share how their newborn experience is going. And again, what are you doing with your baby? How are you getting your baby to sleep? How's breastfeeding going for you? And so just kind of continuing on that community spirit that is in centering.